Now it's time to start the Subcommittee 3, Disaster Resilient Community, Nursing Contribution to Build Safe and Secure Society. I'm going to serve as a moderator today, and I am working for the University of Hyogo. My name is Sonoe Hoshino. Now, I would like to give you a briefing about what we are going to discuss today. The disaster, the frequency, and also its seriousness has been growing. The many people are really endangered by the natural disasters, and at the same time, they give us long-term repercussion of its damages. But 60% of the medical respondents are nurses. We have to play a very important role during the disaster. And ICN also declared that we really have to work for the disaster reduction and also disaster management, and the nursing have to be also adapted.
And Dr. Mashino.
先生の方から、
Then in this session, Dr. Murosaki, he's going to talk on this issue from the specialist in the disaster management.
Hello, ladies and gentlemen. This is Murosaki. I teach at Hyogo Prefectural University Graduate School of Disaster Reduction and Rehabilitation Policy. And thank you very much for this precious time to allow me to speak before you. So right now, the age that we are living is a very disastrous prone area and era. And within this era, I would like to comment that the community is going to be having a bigger role to play. And also, I'm going to be talking about the importance of the medical services. So as I just mentioned, and as Professor Dr. Mashino mentioned about COVID-19 and other disastrous risks, ongoing 50 years is said to be a very difficult one to come. The infectious disease is one type of disaster too, because it is unseen and unpredictable. And with these unforeseen phenomena, it draws something unprecedented. This is indeed a disaster. So my opinion is, within the next 100 years, at least, could be novel COVID-19 or else other type of infectious diseases, and humanity will probably struggle with such infections. And if that happens, and infections spread, what happens if a very large disastrous earthquake happens, or else a flood comes in? Then we will have several triple disasters falling upon us. And currently, the natural disasters are becoming increasingly ferocious. The society are becoming much more vulnerable. And we have to be focusing on the internal factors of the social vulnerability too. The social vulnerability is something that we human beings can shore up if we are conscious to do so. So that means we must create a society which is very strong to disaster. And came the concept of mitigating disaster. Mitigating disaster is when we are facing a great natural disaster. It is not to curtail this force, but then we try to synchronize and live along with the disaster, but to mitigate the disaster falling upon us on our daily lives. So in this sense, right now, what we are questioned by the COVID-19, people are now saying the phrase of a new normal. That means we should create a new societal structure, and we need to create a new way of mitigating disaster. And we have to live differently. And in that differences and changes, community plays a lot. I would like to mention on this later on. So again, disaster mitigation, it means that it is the combination of various measures and then create some subtractions of damages by adding up measures. So first of all, we must make the community resilient, and we must add up to how the time could be meaningful, meaning that it is not only the emergency relief that we should provide, but then from the recovery to reconstruction, we need a mid to long-term countermeasures. Upon that, this is very important. So the human beings try to add up various measures. It could be a relation with the community and the administrative office, and various professionals should be engaged, which is very crucial in the reconstruction. And regarding the subtraction part, it's the human part. So it is to be aware of disasters, and it is about teaching and educating people mitigation of damages. Excuse us, this is from the interpreter. The presenter has stopped he is resuming. And along with this note, the word of community disaster mitigation is very important. So disaster is coming since last year. The reconstructional work and COVID-19 is coming to us on the Japanese citizens by combination. And because of COVID-19, volunteers are restricted of going beyond prefectural borders. So the disaster-hit area are difficult to gain society's aid. So once again, that makes the community help even more important. In Hashi-Awaji, a great earthquake, when that happened, volunteers have been flocking to the area to provide aid and relief. But after that, there was the counter response, meaning that in Japan, when there's a large disaster happening, community should have been standing up on their own to help themselves, but then the community have been relying on the greater part of Japan for the volunteers to help them out. So the people were reliant on other people coming from other areas. But ever since COVID came, we now recognize that we have to be stronger by the community base. We must be reliant on the community to self-help ourselves. And again, various natural disasters will come. Like if you are sick, maybe you might be sick in your stomach and sick in your throat. So little by little, you have various sickness in various parts of your body. Like that, people will be prone to various disasters. And when you are standing up and trying to recover, we have to have public health. So very critical thing is that in the age of disaster, we need to create a healthy body along with a very strong and solid community. That is what the recent disasters are teaching us. So there are things that only community can provide. For instance, the food and meals provided to the shelters. It could be some food and meals prepared for allergic children or babies. And that could not be performed by a higher organization like prefectures or municipality. It should be based on community according to the physical strength or the physical characteristic of a body. The meal should be provided, and that's only the community can provide. And likewise, community can provide some very granular services because community is like sharing a same fate, the joint fate. And it is related to the next point that I'm pointing out. It is about first aid. Immediate response to the situation could only be done by communities, along as being autonomously self-helping and fulfilling self-responsibility, just like what I have mentioned about the meals for allergic children or people. So special responses and response to immediate situations and joint fate. Those are all supported by the community, and only the community can provide. Within this background, when community is going to be creating schedules for disaster, countering disaster, that's happening in Japan, and 5,000 communities in Japan or more are trying to protect the people's livelihoods that where the people lives in, and they're trying to create a plan. So I just mentioned about the people in shelter taking food. The community could be creating a menu for the week. For instance, maybe they could be providing the first day miso soup and plus some other dishes. So when those schedules are already set, then they will be allocating what people could be bringing in for the ingredients when the first day of the disaster happens. So while this person is in charge of the first meal, he or she will be bringing in something that has been picked up and harvested from the garden, so that he or she could be creating a menu for the first day, which he or she is responsible for. Therefore, the community could be creating a very detailed schedule on their own, which is idealistic. And such a countermeasure is now going on. And within the world of disaster prevention, when protecting people's life, we need professionals' talent and knowledges. And I've been living within the firefighters world, and firefighters has been reiterating on the training to save people's lives. And why do we have to be refraining? The same training is, it's all for the sake of saving people's lives. And that goes the same with the medical professionals too. Therefore, we need professionals like doctors, nurses, and caretakers. And in the same way, in the firefighters world, there's firefighters and others who support people's lives. So in such way, within the community, there could be a professional for fire who participate in the firefighters' activity. So meaning each of the residents should be in liaison working together with the professionals. So later on, I'm going to be touching upon this, but before going into that, what is to be performed by community? When we come to think of that, I think we have the concept of the cycle of mitigating a disaster, and that is known to nurses too. Well, nurses, I think you utilize the word like acute or mid to long, but then within the defense disaster world, we say emergency or daily lives and etc. And what is asked for the community is that whenever within the locality, when there's elderly people or somebody sick, people must be working together to save these people. So within the community, we must ensure sharing information. And I just mentioned public health and mentioned that we should retain a great health. But then the community should also think and work and take initiative to have their residents strong in body. And once emergency happens, we have to be confirming people's whereabouts, and people must take shelter or evacuate, or else maybe some social wellness should be provided to those of the needies or who should be taken care, or else make a system so that the elderly could take shelter with peace of mind. For instance, when there should be a meteorological news saying that there could be a torrential rain, then the community people could pick up elderlies to bring them to a shelter. If there is no such plan, even if the authority level is announcing that people should evacuate and advisory is issued, elderlies will not make the way to the temporary shelter. So that kind of a scheme initiative is to be created. And when people are evacuated, the living of the evacuees should be supported. So we need a scheme too. Specifically, it is about managing their livelihoods and daily lives. So, for instance, yes, because of COVID-19, we should be avoiding the 3 Cs, like avoiding close contact and such. Therefore, when a disaster happens during COVID-19, we have to be having a cardboard wall in order to separate people. And when Kumamoto earthquake happened, again, people were surrounded, living in a gymnasium covered around by card boxes. And people were trying to stay there very quietly, but then they were stressed out, not being able to voice out their voice out loud or have a great activity. So, meaning sometimes striking up cardboards within the shelter could be isolating people. We have to have a space so that the children could enjoy studying together or talk together. And although we need social distance of COVID-19, we might have a small area where people can get together and to talk something over and give each other advices. So those kind of support is needed as well. That is something that the community must play a main role. And when it comes to the reconstructional phase, everybody talks together to create a new residential area. So everybody will be having an idea of the ideal area to live as a community. So within that process, community will also play a significant role. Within that backdrop, I've already probably mentioned, but when we're building the city and the area, we need professionals from the construction part, the architect. And if they are not coming in and engaged, no further vision is to be created for the residency. These days, the nurses and the fire professionals and other care professionals are bringing in the intelligence and knowledge expertise upon to the disaster-ridden site. So truly, within a site, the knowledges and expertise of the professionals are being combined in order to create the disaster-hit area. So again, the professional group should be catering to the need which is really needed for the locality. And we need a central hospital, but we need a clinical hospital too, which is providing service to the local residents too. So especially when there is no support from the external part, people will not be able to have room in order to wait for other hospital caretakers or professionals to come in to help them out. The community should have such professionals inside their community too. So I call these professionals within the community a person of the so-called water. And there are professionals from the so-called soil too. So with the soil, nothing is harvested. The soil has to be watered in order to have some flower or saplings bloom. Therefore, community nurse or health workers within the residences is needed. And in the case of Hanshin Awazi earthquake, there was a very small healthcare center in the local area, which they were created by the Kobe people. So again, for people's health, the nurses' power is great. So when the nurse caregivers are intertwined and working together with the community, such society should be created in order to be creating a resilient community. So in that sense, it could be working together with the pharmacists or nurses and medical doctors, and creating some networks is important. But then over beyond that network, maybe there could be educations or every other things like firefighters and administrative works. And as such, networks should be extending, starting from the community to a greater area. And if the nurses will take over and work, we will be very happy. And I think my time is up. So that is all for my presentation. Thank you. Thank you, Doctor. I'm very sorry for this part. First, we lost our voice, so I was not able to introduce Dr. Murosaki. So Dr. Murosaki has been making a presentation. He is the Dean of the Graduate School of Disaster Mitigation Recovery Policy, University of Hyogo, and he was making a practical presentation. And he says the significance of a healthy community, and to that, the nurses is a part of the community. So they are responsible and having the capability, they are able to support the health of the lives and the livelihoods of the local area. Therefore, with the residences, nurses are to work together to create a stronger society. And with so right now in Japan, there was a scheme created. The medical care based on the society or the community is now creating. The nurse, because they are professionals in that area, and nurses will be able to create an activity to work along with the community people. So Dr. Murosaki, thank you very much for your presentation.
続きましては、イタリア看護師はいかに、COVID
The next presentation is going to be from Italy about the lessons learned from COVID-19 report from Italy. So Dr. Walter Di Caro, president of CNI, Italian Nurses National Association. It's very early in the morning in Italy, and
early in the morning. So now the floor is yours, please.
Good morning. I hope you hear me. Good morning and good afternoon. Thank you, Sono, for your presentation. And thank you, Madam President of Japanese Nursing Association, and all members for this opportunity to share about nursing in Italy. As Italian nurse, I really hope to participate. I'm honored to participate to Nursing Now Japan. This presentation is focused on lesson learned about nursing and COVID-19 in Italy. Next slide, please. This is the disclosure. I have no conflict of interest. Next slide. This is the outline of presentation, history and timeline of COVID-19 in Italy, some data, public health measures, health organization during COVID, nurses as modern hero, lesson learned, and conclusion. Next. This is like I think in every nation and part of world, the impact of COVID-19 for our needs. Someone said this is like a meteorite, someone said this is a tsunami. In the reality, some other use a rhetorical of war, but there is a real difference respect the war, because we don't know about anything of this new virus. Next slide. In this slide, you can see some image about 100 years ago of Spanish flu. And there are some phrases that 100 years later, this year, we have the same problems of 100 years ago about schools, about the number of people that died for a new infection, and more or less we have the same public health measures as mask and as social distancing. Next slide. In this slide, you can see some of this is like a initial timeline of how is happened in Italy. Italy was one of the first country in the world and in Europe, the first country in Europe that have a problem with COVID-19. We have the first activation in January 22 at political level, the first task force at the end of January, and the first cases recognized at the end of January to Chinese people. We stay in total lockdown for from March to May, more than 65 days. In this moment, we have three area: red area, yellow area, and orange area. That is different respect some region, but in the red area, that is the north of Italy, until now is like a lockdown. Next slide. And this is at the end of December, 27th of December, we have the initial of vaccination in Italy and in Europe, and this is the photo of a first person that had a vaccination in Italy. That is a nurse that works in Rome at the National Institute of Infection Disease. Next slide. This is some data about surveillance and epidemiological data about COVID-19 in Italy. We have about more than 4,000 cases in the last 30 days. We have in the last 30 days 14, more or less 14 people that die. And at the same time, we have more than 17,000 healthcare workers that have tested as positive to COVID. But the real drama is the number of people in Italy that have COVID. That is more than 2 million of people. And the other things that we have passed the last days, more than 60,000 people that die. Another problem is related to the number of healthcare workers that are positive. In the first wave, we have more than 10% of healthcare workers as positive. In this new wave, the situation is better because we have resolved some problems related to the DP, personal protective equipment. Of these, more or less 50% are nurses. Also, I was tested as positive. I have COVID-19, and I have some. I stay at home, but I have some problem, some cardiac problems, and other typical symptoms of COVID. Next slide. This is the trend of COVID. Now the number of cases is more and more respect the first wave in March and April, because now we have a lot of swaps, a lot of people more have tested. In the first wave, only 10,000 a day was tested. Now, more or less, we have 200,000 people a day that we test for COVID-19 every day. Next slide. This is the organization of this disaster emergency preparedness organization. We have three levels: national level, regional level, and hospital level. At the national level, we have a national task force with some minister involved, like Minister of Health, Minister of Defense, and Protection Civil, and infectious disease hospitals. We have leads by Protection Civil, that is like an emergency national team, and we have an external commissioner for the equipment. At a regional level in Italy, we have 20 different regional organizations and 20 different regional health organization. There are at the same time task force and a network and coordination of hospital transformation. At hospital level, there are other transformation that we can see better in the next slide. The next slide, we have in this slide the change for organization and the change for healthcare workers. The organization have a lot of change because we reconvert entirely ward and department in COVID department. We have a field hospital, hospital in convention center, especially in the north, pre-triage tent outside emergency department, and we have a lot of place where we can test about COVID. About healthcare workers, we have a real shortage in Italy of especially of nurses, and there is the involvement of military health system, the involvement of retired nurse and doctors, NGO and volunteers, and newly graduated nurse that stay in the practice. Only newly graduated nurse, not student of nurse. And we have a lot of international aid from China, from Japan, from European Union and other countries. Next slide. This is the hospital reorganization by region. We have three different models. One model is the COVID hospital, it's a COVID dedicated hospital. The other model is a network of hospitals that have same word COVID dedicated, but at the same time have a COVID-free hospital. And the other model is a traditional hub and spoke. In the capital of Italy, we have hub spoke model with national infection disease that is crucial for the other hospital. The trend in ACT is for COVID dedicated hospital and COVID free hospital. At the same time, we have a military system that have a one COVID dedicated hospital. Next slide. This is some photos of pre-triage tents outside the emergency department because we separate the hatches in the emergency department. Next slide. And this is a hospital in convention center is like only a photo or dedicated hatches for COVID. Next slide. A real problem in the first wave until now is related to the intensive care bed. For reconvert to traditional beds to intensive care, we close some of traditional activities in the hospital, like surgery or like traditional work like medicine, and we reconvert in COVID sub-intensive and intensive care beds. This is create a real problem for people with chronicity or people with problems like cancer or other. Next slide. This is a field hospital. Also now, we have in total, in the first wave, 6 field hospital. Now we have active 3 field hospital, one in the north, one in the center, one in the south of Italy. This is a military field hospital, and we have one hospital from USA. This is Samaritan volunteers. Next slide. This is a real asset for Italy. This is a Aeromedical isolation team. This is air evacuation under high-level biosafety containment. I work close also with team, and this is a military team that is connected with the healthcare system in Italy, and these people flight in every part of the world, all for transportation by plane of people with COVID from different hospitals. In the first wave, we have some Italian people that move to Germany or move to Switzerland for the assistance. At the same time, we have some people outside of Italy that we use this aeromedical isolation plane for return in country. Next slide. This is a number of change in the hospital. We have a double number of intensive care beds. We pass from 5,000 beds to more or less 10,000 intensive care beds. At the same time, we pass from 6,000 beds for pneumology and infection disease to 30,000 beds. It's a real change. But we don't have new beds. We only changed beds from traditional specialty to COVID-19. Next slide. This is about the situation for healthcare workers. Italy have some years of economical crisis and not more attention for healthcare system. We have a lot of shortage of nurses. It's estimated that in Italy we have a shortage of 50,000 nurses. In last year, we have a new hiring for more than 12,000 nurses and more than 5,000 healthcare workers and doctors. Is planned for this year to have for the first time in history, and this is also related to the work of nursing now in Italy, to have more or less 10,000 family and community nurses. At the same time, government decided to have a national task force that move in different parts of the country where it is useful for COVID-19, and we have more or less 500 nurses involved. Next slide. About nursing student, we have some problems with practical part. This is suspended last year. The activity move online. Now restart the practical part in some department, non-COVID department. And the real difference is that we try to graduate before the nurses, more or less three months before, but it's nurses that complete entirely the degree. Next slide. We have this is some slide related to the first wave in March. We have a lot of confusion about the mask, and we have a real shortage of protective equipment, and this bring some problems to number of nurses tested as positive. It's like I see in some interview that is like for a nurse go to the war with paper shield and plastic guns. Next slide. At the start, we have a long waiting list for swabs. We fight for every swabs for every nurses and every healthcare workers. We resolve this problem, but sometimes there is also some regional difference. Next. This is I think the slide is really clear. We have more than 300 healthcare workers that die for COVID-19. These people give their life for save the life. More than 60 were nurses, and 5 of these are suicide. Next slide. This is the suicide. It's the first time that we have nurses in this number that suicide for occupational problems. We don't have a real mental health national program, but we work on this. All these people work in the COVID department and they have a fear to infect relatives or family, and this is an aspect where we can reflect. Next slide. Another problem is related to long nursing home or long-term care or people that is for the older people. In this long-term care and nursing home, we have more or less 50% of COVID deaths. These people, older people, and in this structure, there is problem of lack of staff, lack of nurses, and a general problems of isolation, diagnosis, and general problem of environments. The real drama that this is a private structure, and is now government modify the rules for improve the safety of this structure. Next slide. Another ethical dilemma, and this is we don't have enough intensive care bed. We don't have enough beds or ventilators, and in some situation, doctors and healthcare workers have choose in favor of healthiest patients. And we start also our association a campaign for Save the Elderly. This is a real ethical dilemma. Next slide. One of crucial point this year also is a positive point that media and is a real interest about nurses as a modern hero. This is some picture of famous painter in Italy. Next slide. Next slide, please. This is some first page of a newspaper that is dedicated to nurse with some photos. It's the first time in for this generation that we have nurses in the first page. Next slide. Next. This is other image of nurses worldwide. Next. Italian participate a lot of different activity. Next slide. And this is some message from Pope Francis. That is, Pope Francis is very close to nurses. Also, our association works for some message for the Pope and the President of the European Union that express for solidarity for the health of nurses. Next slide. Next. This is a SWOT analysis that we made inside our association. I won't highlight because my time is like more or less at the end. I would like that some problems, some problem weakness is homemade solution, inadequate digitalization, and at the same time we have some mental health challenges that we have to work on. Lack of real infrastructure for pandemic, and at the same time we have some opportunity. The opportunity is to upgrade infrastructure and education and use this new visibility to change nursing image. One good point is the resilience of personnel, the progressive strengthening of response, and the consolidated experience in the first line. Next slide. This is the nurse role in the pandemic in Italy, I think also in the other country, in the community. We work in contact tracing in community activities for driving testing, the acute care nurse work in triage, direct care and hospital-based infection. We don't have a real advanced practice in Italy. We have a specialistic practice as some of nurse work for health education and counselors. Next slide. This is the some of the lesson learned. Necessity of a quick adaptation to this variety of emergency. Sometimes in the first part we have no capacity to plan adequate staffing of nurses, especially for intensive care and community care. Some problems related to nurse competencies about infection control and about community care. Some necessity to be ready as a nurse, as healthcare workers, to work in different conditions with less technology and lack of resource uses, crisis standards of care. Next slide. In this situation, we have some unexpected difference in expert indication to better understand pandemic prevention and response. So, I think we have necessity to revise some point of nursing education with new competencies for infection control, community care, and data analysis. That is a real point of data analysis because we don't have real good data. Other problems is related to risk and safety of nurse, and we have work more for standardized guidelines for a new modality to communication, because new PP is a problem for communication with team and with patients, and we have necessity of leadership, as I said, nursing now. Next slide. This is one of our campaign as association in Italy. We start with this campaign at International Nursing Day in 2020 for unlock nurses potential, and we stay working with other associations for resilience, reimagination of the system, and we have worked a lot with I think all the country and the government, I hope, work for re-engineering entirely the healthcare system in Italy. Next slide. And this is the last slide. Thank you to you. I am really honored to share this experience. We, as a nurse in Italy, I think all the nurses work over the limits, over the physical limits, over the mental limits, and is an example of commitment. As an example of commitment is a Japanese nurse and nurse worldwide. I think we have to move for improve the role and the leadership of nurses at the policy level. Thank you for this opportunity. Thank you, Sono, for your presentation and for all.
Thank you, President De Carlo. イタリアの看護師さん
So nurses in Italy are really in a very dire situation, both physically and mentally, and it was a very dire system. Over 70 people died, and 5 killed themselves, and it was a really shocking number for us. And the number of infected people are increasing dramatically, and then that also gave the negative impact to the regular patients, and resources are very limited, and the local nurses also suffer from the ethical dilemma. So this is not just a fear of the physical infection, but also mentally they become fatigued and really give a negative impact. But the Italian nurses are now, even in this dire situation, trying to work for the future and still thinking of the education improvement and also enhancing the leadership in the policies. And I think that the shortage of the nurses are really giving a negative impact. But I think that they will be voicing the necessary reinforcement of the leadership in the future. We learned a great deal from you. Thank you very much for your presentation, Dr. De Carlo. Thank you very much from the very early morning.
ここからはパネルディスカッション
From here now on, we would like to start our panel discussion. The panel discussion is going to be under the title Contribution of Nursing to Disaster Relief in Japan and Abroad. So I was not able to communicate on the upfront. And today, because of this tool, I'm not going to be able to listen to your opinions and idea directly. But then if you do have any comment to make, please write it in the chat box. If we do have time, we would like to come back to the chat box, and I will be introducing your questions and idea to everybody. From here on, we're going to be inviting 5 panelists, and panelists are going to be making their presentations one by one, and then after that, followed by panel discussion. First of all, contribution of nursing to disaster relief in Japan. And so Ms. Kumiko E is going to be making her presentation. Ms. E, please.
Thank you very much, Dr. Mashino. Good afternoon, everyone. I am the Vice President of the Japan Nursing Association. So I would like to share with you that what we are doing at the Nursing Association to enhance the capability of the nurses. So the trigger point for us to work on the disaster was the Great Hanshin Awaji earthquake. At that time, the nurse volunteer was done by the Dr. Mashino at University of Hyogo, and they established the headquarters to organize and dispatch these volunteer nurses. And after that, the Nursing Association started working on the disaster and currently dispatching the nurses for various disaster-affected sites. So what are the roles of the nurses? First one is to secure the safety and also security of the nurses, and also protect the hygiene and also the medical condition in the communities. So first of all, the headquarters must understand the situation of the disaster-affected areas, and also have to have a communication with the people working in the communities, and provide the recommendations, and also work on the government and also the political party for that the demand of the local people can be implemented. So this was the East Japan Great Earthquake. This was one of the biggest disaster that we had recently, and this is what we have done. We provided the requirements for the government and also political parties, and I think this role was very important. Through various networks that the nursing association can receive various voices, so that as a specialist that we ask for the budget and also fundings, and in a very accelerated manner, so that we can really provide good services for the local people. And I think that our association has a very important role here. We have dispatched 938 nurses, in total 3,770. Another important point is to conduct a survey among the people who worked in the communities. The nurses in that affected area lost their families, sometimes lost their jobs, and in case of a large-scale disaster, we really recognized that the local nurses also affected by the disasters. So that's why our role is critical. And we had to do some PR activities, and also have to secure the people who are working for these type of projects. Again, what we done during the East Japan earthquake, we helped the local community for almost 5 years after the disaster. And had to work on the necessary countermeasures. So provided the recommendations, and then conveyed the requirements of the local community to the government, and also worked on the upgrading the level of the skills, and also worked on the infection control, and especially a nuclear disaster also took place. Therefore, that we had to help in that regard too, and had to secure the human resources. And in a larger scale, economically, we had to work on various matters. So we also got involved in the distribution of the disaster aid. And those are the things that we had to do in the large-scale disaster. So from now on, I'd like to talk about a little bit of a history of the disaster supporting nurse. There are two roles for them. First one is to support the nurses who are affected by the disaster, and also second one is to help the people in the disaster-affected localities. So these two are the major roles. At this moment, the number of the nurses who have registered to this disaster supporting nurses are 10,355. So this was the number of March 2020. So this is about the disaster supporting nurse. I'm not going into the detail. And this is the nursing association, so that you have to be a member of the association, and the person have to be experienced nurse and also receive the training. And there are a few other criterias, but at the time of disaster, you really have to be active and also provide the services in a very safe way. And those are the very important things to work as the disaster supporting nurse. The period of the activities. Up to now, about 1 month after the disaster should be the time frame. And the location of the services are at the hospitals and also shelters. But there is no limitations in the location, so that when nurses are required, that we dispatch them. So this is the scheme to dispatch the disaster supporting nurse. So this is the professional helping other professional, and this is the system that we are thinking. So first we get the request from the prefectural nursing association. First, the prefectural association must request us, the nursing association, to dispatch the nurses. And after those requirements are received, that we dispatch the necessary numbers of services. And up to how many nurses are necessary, and also the level of the aid. There are 3 levels. Level 1 is within the prefecture. Level 2 is including neighboring prefecture, and the level 3 is at dispatching the nurses all over Japan. So these are the activities that nurse does. They work at medical institutions, and also helping sometimes the nighttime, and also some the off time, and also helping the local people. So not just the local people, but helping other professionals. Well, having said that, the disasters are taking place much more often and much more seriously recently, and I'm sure that all of you feel that. So we have accumulated experience and try to prepare our organization to cope with these different disasters, but there are also challenges. And it is not easy to just discover what are the real necessary things to provide. The nurses have to be protected too. And I think that there are still more ways to really improve this. And when the headquarters is really affected by the disaster, what's going to happen? So we really have to work one by one to really improve the situation. So we are still in the way to work to improve the situation. So these are some of the things. So this is the last one. So I will listen to other people's opinions, and we really have to work together. We are professionals, and we have to protect other nurses, and at the same time provide the services for the people affected by the disaster. So that we have to give more proposals and also recommendations for the policymakers. Thank you very much. Thank you for your kind attention.
様どうも本当にありがとうございます。
Thank you very much, Dr. Yi.
赤十字病院
Now, next topic will be from Ms. Naoko Ikeda, Director, International Relief Division, International Medical Relief Department of Osaka Red Cross Hospital, and she is going to be talking under the title Contribution of Nursing to Disaster Relief at Home and Abroad. Ms. Ikeda, please. Thank you very much for having me. Can you hear me all right? I will now start my presentation. So I am going to be talking about the nurses and their contributions to disaster nursing and disaster medical in and out of the country. First of all, for domestic aid. Right now on the slide, we have a photograph for 1995, the Hanshin Awaji earthquake, and 2011 Great East Japan earthquake, and 2018 Kumamoto earthquake. I am going to be mentioning on these disasters that hit Japan. And so the current disaster medical medicine and disaster nursing was impacted by the Great Hanshin Awaji earthquake, and there was number of casualties and injured. And until that point, the emergency relief was being done by Red Cross. And I myself, when the disaster hit, I was at the area. And I was so overwhelmed about the size of the disaster and the lack of the resources and number of people lacking. And it reflected on me that I was also not capable too. And learning from this great earthquake, especially in disaster, I try to work on the disaster medicine and disaster nursing at the initial acute term and in the mid to long run. In the the nursing within disaster was not within the curriculum of the teaching side before the Hanshin Awaji earthquake happened. But then after this earthquake happened, then the disaster medicine, disaster nursing is now started to be taught in universities too, in order to be able to make first initial response when a disaster hit. And in 2005, there was a railway derailed, and the compartment has been hitting into a building. That was a major disaster too. So people were mostly focused on the community aid. But on the other hand, the problem was that people shed light to the problem where people were dying within their own. They were not helped and they were not related to others. Therefore, they have been not being able to live within the society well. And now next about the 2011 Great East Japan earthquake. At that relief, we have been, and I have been working on relief aid, setting up a tent just right before the town hall of Sendai. And compared to Hanshin Awaji, the injured people was not much found, but it was mostly about people taken away by the tsunamis. And the central work of our aid was within these shelters, and it is incomparably large. The medical personnel has been coming in to help us in various ways. Therefore, we needed to be coordinated. And at the task force headquarters, not only for those people working at the site, we had to find out who needs what in medical sense. And we had to be working together with the nursing care or the nurses working on the on-site, or else we will not able to prepare the medicines or others. And during these tight days, people, the residents hit by disaster, had to be cared mentally wise. And for those people who have been suffering chronic sickness, if nothing was done, they will be going to worse health. Therefore, we had to shore them up. And in order to do so, many of the nurses has been acting longly to support the people hit in the disaster in order to sustain their health. And as my own opinion is that during the acute area, going on to the reconstructional area, I feel that this is going to be a very crucial time, and this is also a very difficult task to perform within this time. And during that time, I'm now going on to Kumamoto earthquake, and we have been setting up tents in order to provide X-ray services and utilizing the past experiences according to the needs of the residents. We have been diversifying our service. And it used to be that mental health activity was done one-on-one. However, in Kumamoto earthquake, we were able to set up the rooms or space, such as kids' room, therefore following them up in groups. And the disaster nurse was working with us, or else other people coming from other organizations has been working together too. But then when the organization of the personnel is different, the direction of the organization was sometimes different, or else maybe the term of their services were also different. Therefore, we were not able to work consistently. And unfortunately, the emergency people, at shortest, they only provide service for several 2-3 days, and sometimes for several weeks. Sometimes the new team was not able to gather the information that the former team had. Therefore, the new team that has just come was negatively impacted because they did not have good relationship with the local people, and the health care taker and the nurses that came from the community helped us a lot in that front. In order to provide services to the needs of the residents, the special nurses were asked to provide their services too. And I think from here on or furthermore, we're going to go into that direction. Therefore, once again, the disaster medicine and disaster nursing is once again focused for education at the schools. And at the disaster hit area, we must have a network of the community, and the nursings and the midwifers has been dispatched to the area. Therefore, we should utilize such expertise that is restored within the area. And now I would like to talk about emergency aid during disaster in the international front. And so in the international aid, there's the emergency aid, and then there's the medical support for conflicts and development aid. And right now, this time I'm going to be talking about the aid during disaster and the aid during the conflicts. When the international aid happens within the disaster hit area, because the local country is not able to perform every services to their residents, as we are called, and the emergency unit are going to be bringing in all medicines and all equipment into the area. The Japan Red Cross is utilizing the idea of the International Red Cross. One rotation is 4 to 5 weeks, and at the longest, we're going to be providing service for 4 months. And we are setting up clinics at the point, and we're going to be making patrol clinics too. And during our services, we are providing nursing, and we are now training the local staffs for the logistical issues. And after our activity is finished, we're going to be donating our equipment to the local medicine professionals. So 2 years ahead, 3 years ahead, sometimes we do provide some training at the site. And the larger assessment within the conflict-ridden area, we do perform too. Sometimes we work in such ways. And we provide assessment too for rapid assessment for the disaster. But not only that, we need to have an early recovery. Therefore, we do some assessment for recovery too. And for disaster preparedness, nursing who is able is going to be taking the leaderships. So nurses are now going to be taking the greater leadership than compared to the past. And the team's discussion, coordination and discussion and judgment, all the practical knowledges is going to be utilized and leveraged within such decision making. And lastly, I'm going to be mentioning about the medical assessment in conflict area. Currently, year-on-year, conflicts are happening, increasing around the world. Explosive and guns are hurting people. Or not only that, people become refugees and people are disabled. Or some people loses and does not have any home to go back. And I myself helped at the Red Cross hospitals internationally and several times. The injured are going to be transported by airplanes or cars, and utilizing limited equipment, we are providing the medications. However, the activity of nurse is not limited to that. We are going to be aiding the people who are under violence, who has trauma, or else people scared of going through multiple operations. And we are going to be making coordination adjustment with the local mental clinicians. And whenever the POW, the personnel held in wars are going to be detained, we are going to be sometimes coordinating with the person in charge of people or hostages under war, or people who were kidnapped too. So sometimes we do have some helping aid to the families who had their children kidnapped. And we are sometimes standing at the very front line of the conflicts around the world. So from here on too, we are going to be understanding the diverse services provided by ourselves. And with that determination, we should create and work on the good activity. Thank you very much. Thank you very much, Ms. Ikeda. And now next, from
So next one is going to be about the supporting and mother and then children during the Great East Japan earthquake. Dr. Yukari Igarashi, the health and midwifery of St. Luke's International University. Good afternoon, everyone. I am Yukari Igarashi. Thank you very much for giving me the opportunity to speak to you. I'm from the St. Luke's International University. I'd like to talk about what we have done and also learned from the supporting activities in 2011. And I really want to work on how to create the safe and secure society. First of all, what we've done. I am from Iwate Prefecture, so that when the East Japan earthquake took place, I was involved in 3 months activities of helping the people in Takada City. This was the taken I took from the higher ground. The tsunami took everything from the town, and everything has been destroyed. So when I walked in the Takada Sea, it was like this. It is almost like no houses remained. I visited many shelters and also had a meeting with the health and the medical teams. And these are the challenges that they couldn't really maintain the hygiene level, and also informations are lacking, especially for the women, and also security-wise, the people were really suffering from the rampant crimes. So first of all, we worked on dispatching the devices for the women. So women are suffering from the various situation in a different generation, so that you really have to have the douche, and these portable douche has been well welcomed. So we distributed 6,669 different sets. The name of the sets called the not demo or bag. Not demo in their dialect means everything, so everything's back. So this was a picture that we took during that dispatch. And these are the things that we discussed and discovered what were the problems. So these are the things that's necessary by the people in the shelters. These are not just for the period related products, but also there are more things that's necessary for women than a man. For example, only for women that there are so many things that they need to have, and also according to the generation they need to have different things, and also they have to play a lot of roles, so they also need to have many things to prepare for the daily lives. And during the disaster, they get stress, and therefore that some mental disturbance may occur, and also difficult to maintain their hygiene levels, and the complication may occur. And it is going to be the 10th anniversary this coming March. And what we have learned from the victims, and I hope that I can contribute to the society. So I would like to discuss with you what are some of the proposals. So Sendai Bosai Bakugumi, I think that you have heard about it, the Sendai Framework for Disaster Risk Reduction. So 2015 that they have produced this outcome paper, and 4 different prioritized activities, and then 7 different targets. So the one of the concept was called Build Back Better. And again, you probably know this concept. The reconstruction should be much better than before the disaster, so that the local people can be prepared for the future disasters. And also, the disaster-related investment has much higher ROI than the work that you do after the disaster. So Build Back Better is always a very important platform for the future. So when you introduce this idea into the nursing activities, so what can we think of this? Build Back Better. Being more resilient, you really have to have the investment beforehand. But this is not just about the hardware. You have to develop people, and you have to really develop the training system, the software side. So for the preparation for the disasters, you have to really go day by day. And as the nurses, what can we do for people in the communities? You often talk about the preparedness for the disaster, and everyone probably think of it. But when it comes to actions, that you always have to imagine that what you are doing and what you are preparing are really working for the disaster, but not just for that, after the disaster, during the reconstruction period. To do so, the Build Back Better concept is not the only one, but you really have to think of the positive idea of being better. you really have to connect that to the action. The self-help and the mutual help are necessary. For the self-help, you really have to do the self-care. By doing so, even during the disaster, you can maintain your health level. And during those times that it is very difficult to maintain yourself. Therefore, that even during the peaceful time, you really have to do the self-care. And this self-care has been well communicated, but as Dr. Murasaki said, that the new value of the maintenance of the health is to be prepared for the disasters. Even after disaster, people should really maintain their health so that it can contribute for the build back better. And during the COVID, that you cannot necessarily go to shelter. You sometimes have to stay your own home and really do the health care there. Especially for women, those are the symptoms that the woman usually suffer during the disaster. So you really have to go to get a checkup, especially for the women's disease. That let's say like you have some suffering in the period pain or some disorder in the periods, then you really have to go to see the doctors, and it really gets some peace of mind. The menopause. You have to work on the stretch and then massage, that you have to learn that what would be the best way to reduce your pain and also negative images. So you should not be patient with these different symptoms, but you have to really take it. And you cannot really just depend on the medicines. Next one is a mutual help. You have to repeatedly train yourself. You have to evacuate yourself, and people are involved in the reconstruction, which means that you have to have a good community. This was about the West Japan torrential rain disaster. This was a Shimobara of Okayama Prefecture. 350 people were living in this district, but there was 0 victim because they done the training and drill every time, and they knew that who should communicate who. So even during the COVID-19 pandemic systems, when the disaster takes place, you have to think of the evacuation and also the drill and have to work on them. So what we can do is to emphasize the simulation to the people. In the medical situation, that the simulation have to be done. You have to imagine that what would be the emergent conditions, and it is life and death situation, and you can actually identify the issues and challenges during the simulation and drill. And also people who have supported the disaster area have to communicate what they've done and also learn and be prepared for the future. The mutual help means that you have to communicate that what would be the way to help other people. So you always have to project the nursing perspective to the trainings, and have to make sure that there are some vulnerable people who need more help. I am a midwife, so that I often talk about the pregnant ladies, and mother and the children have to have a privacy for themselves, and also have to have a place for them to breastfeeding for the babies. So build back better is a very important perspective, and even during the COVID and also complex disaster, that you can have a very good system to contribute to build safe and secure society. Thank you very much. Thank you.
次は実
Thank you very much. So the next topic is going to be cooperation between voluntary disaster prevention organization and nursing. The presentation is going to be delivered by Dr. Yokohama Date. Mr. Yokohama Date. Ms. Hamadate, please. My name is Hamadate from JICA. Thank you very much for providing me such a great opportunity for me to present. Today I'm going to be talking. So I was learning at the postgraduate until this March. And when COVID-19 had been generated, I have been writing a thesis about nursing and COVID-19. I would like to present on the topic. So without ado, I would like to go into the topic. As everybody knows, when the Great East Japan earthquake occurred, approximately 3.5 million people were unable to return back to their home in Tokyo. In the event of such earthquake happens in Chiyoda ward, when such a major earthquake is going to be occurring, we assume that such large number of people are not able to go back to their homes in Tokyo. So this is one of such ward, Chiyoda ward, and within the Chiyoda ward, there was voluntarily a company-wide aid organization created, and 94 organizations and companies are voluntarily within the team. And this organization is holding seminars and assembling once in 3 months. They are working on training for people to be brought home. And also, they are holding an event to network with medical people. And I have been also in part with such and response starting 2013. And through such the activity of this voluntarily company, people have been active learning on training and studying sessions how to be coming back home without any major injuries. But we do have yet to learn. Therefore, as a nurse, I have been considering what I can do as a nurse and provide idea to the members. So in order to maintain the acceptance of people who cannot return home, or how to transport the injured and sick and maintain life and health after accepting people who cannot return home, and others were thought by us. And the goal of our action was the promotion of measures for people who live in difficulties returning home when a major disaster happens, and with the ultimate goal of enabling people who have difficulty return home to stay safely and comfortably in temporary accommodation facilities. And by having this activity, we have been focusing on to improve our activity when a major disaster happens. In order to promote such activity, we have been focusing very much on the concept that Florence Nightingale has been teaching us, meaning that within the area after the disaster, healthy people and people with epilepsy, elderly people and children spend time in companies and temporary living environments to maintain their physical health. And based on social cognitive theory, we empower the participants and encourage them to change their behavior during our activity. I would like to share 2 actual cases that we have gone through. So one case is we have set up a game facility for the temporal accommodation for the 3rd day after the disaster, and this was held in Shizuoka Prefecture. So the target people were the disaster prevention managers of the member companies of organization, and assume that actual temporary accommodation facility accepting people who cannot return home are receiving the peoples. So let me introduce you what we have been working on. So let's say this is a test case that some members who runs a temporary accommodation collapsed due to fatigue. So to have that scenario, we asked the participant to go through the scenario and how they would respond to such. And participants have been understanding and giving us feedback that a more unprecedented issue will happen during the accommodation. And some people says that they learned a lot and it was very educative and informative. And so during the drills for the companies who participate and the voluntarily disaster prevention team has been providing us some ideas and they have been contributing to a lot. And so the researchers from the eye point of the nurses, they have been providing the information and ideas a lot, which they were not focusing on before. Let me introduce you the second case that we have been working on. This was creating a list name of to be filled at reception desk when people comes into a temporary accommodation facilities. And so with the people in charge of the disaster prevention, as a practical training, we created register cards so that people residing in the accommodation facilities will be know much. And with the registration, we were very mindful to return the people going back home, not undermining their health. So specifically, we started the registration card by filling people's medical histories and sicknesses, what medicines they need, etc. And we also thought about other languages version too, not only Japan. That was an idea from the participants. So as such, we have been discussing fully with the members to create facility resident cards in 5 languages. In Japanese, we created the card and then the list, and then followed by the English translation. And English translation was translated in other languages too, and completed a list so that it will include people who need special care too. And this card was created on the organization's homepage, website, so that people will actually be able to utilize these cards and take advantage of it when actual disaster happens. So as such, we have been promoting the healthcare measures. And so the nursing activity is now supporting the activity of the local companies. So specifically, the member companies and the neighborhood disaster prevention organization will be promoting the health measures and also promote people to be able to send the local people and their workers to return home safely. And we were able to support that. Regarding public health and promotion of the public health, from the participant, we got a feedback that in order to have our company personnel understand about the disaster prevention, this training was very good, was one feedback. And it used to be that all organization was thinking in a silo manner about the disaster prevention. However, now going through this training, people are now having the mindset to act and think cross-department. So as such, in order to promote the activity of companies, we are supporting the support so that the employees will be having a better health, and we are supporting to have a better relationship with the local administration. And all these were proved to be done. Lastly, let me share with you what we're going to be thinking for future initiatives and future issues. So from here on, we will work on cooperation among government and businesses to solve issues in the event of a disaster in the community, and also would like to verify what the community can do. And currently, with my professors at the postgraduate, I am going to be investigating and making further researches too. And we're going to be working well, what we can do for activity during the society and the era of COVID-19. Now for the issues. Right now, we have an approach from the company side, but then in order to have the companies work longly, the people within the companies will have to be working more. And this is also my problem too. I do not have an industrial medicine grade. Therefore, I would like to have that as my qualification in order to be able to actively working on the personnel working in the company. Thank you very much for your presentation.
最後は
Last one is about the nursing necessary for the disaster mitigation in the community. So Dr. Mariko Ohara, the Seisen Jogakuin College, will be talking to this topic. Dr. Ohara, please. Thank you. Dr. Mashino, thank you very much. I'm going to talk about how to raise the local nurses who can contribute to the disaster mitigation. Sorry. My slide. Dr. Mashino, do you have my paper? Yes, it's shown now. Thank you. Thank you. So 7 points that I would like to cover today. So the context of my talk is that when you think of how to mitigate the disaster level in the community, you have to raise the nurses who can work in that localities. And we have prepared almost 4 years from 2017 to create the training workshops and others. And these are the things that the cycle that we shown during the disaster, and during the peaceful time that you have to work on raising the nurses who can work during the disaster. So during the peaceful time, based on the management plan, with the partnership with the government, you really have to work on how to reduce the level of the disaster, and disaster training plan, and also the evacuation plan, and also seminars are all included in this. Now, the roles of those nurses, first of all, is to support people. Working with the officers of the local government and also community members, promote the health and also livelihood of the first one is a triage, or the people who need necessary support, and helping creating the shelters, and also checking the people who are already evacuated from the home or not. And this is the special training courses, which is at the Japan Nursing Academia. And currently, the Education Activity Committee approves this special certificate. And after this certificate is provided, that people who can help the people during the disaster is called Machino Gensai nurse. However, this is a certificate provided by the academia. There are some requirements and also several conditions. Especially the requirement for that is, first of all, to finish all the necessary courses and pass the test and also register their names. And how to work on the trainings. This is a leadership trainings. So 30 hours of the classworks. So 6 hours times 5 days. And the field work 30 hours. This is the individual work. The challenge one is to go into the community and learn about the disaster mitigation. So visiting the local government and also the office to explain what they are, and also have the relationship with the people who are working in the government. The second point is to create the education program to increase the more nurses. Have to think of how to communicate the program and what would be the teachers and how to get the fund. These plans have to be done by themselves. And after that, they get the test, objective test, small essay, and also self-evaluation. So Machino Gentai nurse leaders have to be prepared from step 1, the training, 30 hours, and step 2, after finishing this classroom work, they are evaluated according to their individual work. And as a leader of the Machino Gensai nurse, they go back to their locality and have to work on training other nurses and also follow up. So up to now, 73 people have finished these classes. The first and second terms already completed. Third one is still working. And the number of the participants are different in different prefectures. Saitama, Nagano, Miyagi, Fukui are the areas have more numbers. And first step and then second step, where they belong and then what their names. They work in the medical institutions, and the 40s and then 50s are working in there because they have experience and also nursing experience, and they usually come and get certified. So as for the training workshop, these are the common lessons that they learned. During the peaceful time, they understand that the comprehensive regional comprehensive care centers' roles and also the relation among them. And each student share their views and challenges among themselves so that they grow solidarity among themselves. So even during the peaceful time, they really get to know the local people, and that's very important for the Machino Gensai nurse. With respect to COVID, the students of the courses have understood that their role would be very important during the pandemic. So this is some of the activities that the Machino Gensai nurse got involved. First one is that the planning of the training seminars and also implementations. Up to now, that they have a relationship among people, so they can look for the resources to promote this. And this is the person who finished the course in Eiheiji town in Fukui prefecture. They invited 8 people, and also head of the town and also fire brigades were all there. Second one, with a partnership with the local government, they plan the COVID-19 seminars and disaster management seminars. The third one is to work in the volunteer centers and also teaching to the local volunteers and also reportings. So these are the things that they've done. And the number 4 is to have a discussion with the emergency and the person who gets certified have invited the people who are involved in all these management areas and started having the COVID prevention countermeasures and also planned the special seminar for the residents. So for the future, Machino Gentai nurse leadership should be certified even wider by the academia. Hope to have Machino Gensai nurse leaders in every prefecture in Japan so that they can foster nurses in their localities. Leader has to be the key person in communication among local governments, medical institutions, and also community offices. And during the pandemic, they really have to study what would be the role of the Machino Gensai nurse. But for the people who have learned that they are already leaders, but sometimes they have some reservation about whether they be the head of these activities, but they're very proactive and they are energetic to work on this. Thank you very much. This is the end of my presentation.
小原様どうもありがとうございます。
Thank you very much, Dr. Ohara. So now the presentation of the 5 presenters are done, and the remaining time is very scarce. But we would like to ask the 5 presenters to debate and have a panel discussion. From your presentation, we are now understanding that there's various way of nursing within disasters. But everybody mentioned about the coordination of nurses with the community and the residents, and nurses are very much responsible and playing a very big role in their activity to maintain the health and life of the community people. Lastly, I do have to close the session, so from one person each, regarding the creation of the society which is resilient to the society, I would like one comment each from each presenter. Because we would like you to send all the listeners your message. And I would like to ask your comment in the order of your presentation. So Ms. E, can you make a comment, please? Thank you very much. From my side, I was listening to all the presenters' presentation, and at the time of disaster happening, and right now under COVID-19, nursing is indispensable. So I was once again very aware that we are working in a very indispensable condition. And COVID-19 makes us nurses work in the front line the society is closing up on how to secure a number of nursing. Therefore, the Japan Nursing Association is playing a central role in order to secure the number of nurses needed by the society. But on the other hand, nurses must be protected too. And we must be guaranteed and compensated, remunerated, and guaranteed of the services that we have provided to the society too. And because we're the professional association, we also must focus very much on our policy in order to protect our nurses too. From here on too, I would like your great support too going forward. Thank you very much. Thank you. Thank you, Doctor. Ms. Ikeda, any comment, please? Thank you. So once again, in every person's practice, I heard that nurses are getting better and stronger ability in every area, every front. So how to create a better system to coordinate is going to be our future challenges. And the nursing area, there's a lot of area that our contribution is not visualized. People are not recognizing the area that we contribute. Therefore, I think we should put in much more energy to visualize what we have been performing. And during COVID-19 too, we would like to ask nurses to act by having that in mind. Thank you. Dr. Igarashi, please. Thank you. I was listening to every presenters, and you were talking in various areas, but then there's a underlying common idea. We should be preparing to the disasters, and we have to be creating the system or the rule. That is a large idea, but then we need a very detailed idea too in order to work efficiently. Therefore, we have to work out both in tandem in order to be effective. In COVID-19, we see the policy of the government. They are giving us instruction, but then the action is taken by each nurses. Therefore, I think what we act is very meaningful. And I've been emphasizing on build back better. But this word is not applying only to the people who are disaster-ridden. Build back better is also meaningful to those who are not hit by disaster, because everybody is possible to become hit by disasters too. So everybody should take it as their own matter. Thank you. Thank you very much. Ms. Hamatate, please. Thank you very much for letting me speak today. And I've been following every professor's presentation. And to the preparation of disaster for myself too, I would like to act and cooperate. And I again felt how widely the nurses are working, providing their expertise. To that, I think for my activity too, I would like to utilize my expertise and experience much more too. From here on, yes, I would like to visualize and try to voice back all the activities that I am going to be working on. So little by little, step by step, I would like to contribute to make the community more resilient. Thank you. Thank you very much on your comment. Dr. Ohara, please. What we are working is giving training to nurses who work with communities to mitigate disasters. But this is all starting from scratch. And as Dr. Murosaki mentioned, I think we are really starting for the very first end. And we should have a inch up, and we have to be working along with the administrations and the local governments. So from here on, in order to work effectively as the nurses who work with communities to mitigate disasters, we really have to be securing a space where we work to put our hearts on. So all the presenters today, they have been making all the presentation that was very informative for myself in order to expand my activities. Thank you very much. thank you very much for our 5 panelists, and we would dearly want to be extending our discussion, but then time is running out. And COVID-19 is also considered as one disaster. It is different from earthquake disasters and other disasters, but then the role that nurses are going to be playing are all the same, common with common disasters. And a disaster happens, nurses are needed. Of course, nurses are needed at peaceful time too. But nurse activity is not recognized much in the world or the society. Therefore, leveraging by our ability and capability, we would like to contribute to creating a safe and secure society. By listening to you, I felt that. And President Biden has been inaugurated, and he's been talking about Build Back Better, and he's been also talking about unity, not separation or division. So we should liaise together, network together, and we nurses are going to be the key people who is going to be coordinating within the community. So whatever we learned within the condition, we would like to give it out as an information and to utilize this to make a better community. I think nurses are able to do so. So once again, thank you very much, the presenters. And lastly, the COVID-19 is rampant, and many people are losing their lives all around the world. And during the COVID-19, many disasters are also happening concurrently. People are losing life, and I am praying for their dear lives too. So lastly, for the people who are under recuperation treatment under COVID-19, and those people, essential workers, medical professionals, and nurses who are working for saving the lives of these people, I would like to send my prayer too. And with that, I would like to end our concurrent session. Thank you very much, presenters. So the concurrent session number 3 is going to be finalized with this comment. Thank you very much for your participation.